joined now by Will Krawszik from Opportune Therapeutics. Will, thanks so much for joining us.
Good to be here, thank you.
So Will, I want to start by just getting you to tell us a bit more about Opportune and what you do.
Okay, so we're a biotechnology company, and what we do is we take the 3D structure of a cannabinoid, and we take the 3D structure of the receptor which it binds to, and we predict the interaction. So we've just had a grant that's going to take each one of the active ingredients from cannabis. There's roughly 500 of them, and we're going to screen each one against different receptors and see what diseases they can influence.
Excellent. And so in practice, what does this look like? Could you say to somebody who has a certain condition that this strain might work best for them?
Yeah, so that's, let's call that the natural cannabis solution. So that would be looking at what strains have the better percentages or ratio of the different cannabinoids. But then our technology allows us to move into the engineered cannabis. So that's looking at synthetics and modifying some of these structures so that they can be more optimum for the diseases that they treat.
Really interesting. And you're a technology platform, so you don't have a license, you're not doing any type of cultivation or production. How do you work with licensed producers or manufacturers or pharmaceutical companies to commercialize what you've built?
So what we have is a knowledge base. We think of ourselves as a data company, and we have this advanced knowledge of cannabis pharmacology and what it might be able to do. So what we want to do is be the perfect partner for different LPs, pharmaceutical companies that have ambitions to work through the preclinical phases of drug development and all the way through to regulatory approval.
Really neat. There's been a lot of talk about pharma and the role it's going to play in the cannabis industry today. What do you think that role is going to be, and how soon do you think that's going to happen?
It's an interesting question, and a question that lots of people are asking. So currently we've not seen any big moves from the pharmaceutical industry. There is interest, and a lot of the data that we acquire actually comes from the pharmaceutical industry. So whether it's direct, the taking up of the cannabis industry through pharmaceuticals, or whether it's just leveraging some of the data that we have, pharmaceutical companies still stay a big part of our audience and our client base.
Really interesting discussion. Thanks so much, Will, again for joining us.
Okay, thank you. Cheers.